Hi everyone, in this video we are treating crow's feet. So we are starting off by just palpating that orbital rim and making sure we are injecting outside of that area. I am treating very superficial. You want to see that little bleb form. And here we are treating a brow lift. So I have that patient squeeze tight so I can see where that muscle is pulling the strongest, and this is going to help elevate her brow. As you can see, she has some hooding in her lids. She has a little bit of a heavier brow as well. So this is just going to help counteract that Frontalis treatment that we did as well and just give her a beautiful lift to her brows. Now we're treating DAO. I always like to place my finger and feel where that muscle is pulling the strongest. We are going oral commissure down and about a centimeter to 2 centimeters back, and that is how I find my injection point. But I always like to palpate as well because that is going to be, 100% we know where we're treating because everyone's anatomy can be a little bit different. Now we're going in and treating the patient's frontalis. We are making sure to treat high. Again, coming back to her brows, we want lift. So I want to leave a little bit of activation in that frontalis muscle to be able to lift up her brows and help that brow lift that we just treated as well. Now treating the glabella. Here I am treating the procerus, and then we are going to treat medial and lateral corrugators. This patient, again, we are trying to lift her brow, so I am doing a pretty heavy dose in this area to help lift her medial brow. So just palpating that area, I place my finger right underneath that brow bone, just for a little bit of support and to block off that area. And now I am just placing my units. And I did my heaviest dose in the medial aspect, but I am doing just a smaller dose in her lateral corrugators as well. As you can see, she is pretty strong in this area, so I wanted to make sure that we hit those tails as well. And again, just placing my finger right along her brow bone and going about half needle depth and treating that lateral corrugator. Now moving on to the other side for crow's feet and brow lift. I am keeping my placement of my toxin high along that orbicularis oculi. Again, coming back to her brows. She was really concerned about her lids and wanting to have a more open look. So I'm making sure that I'm not treating all the way around that orbicularis oculi muscle. I want to achieve lift and not make her feel heavier. So we are treating up high for her crow's feet as well as her brow lift. Very superficial for my brow lift, and just again keeping my thumb right underneath that brow bone. Now we are treating mentalis, so I like to just have the patient activate right before I am placing my units. We are going to be treating this patient's platysma bands as well to help lift her jawline, a little bit of that Nefertiti lift. For my jawline, I treat just low right along the bone. This is where our platysma is connecting, so I am just treating very superficial. I leave my finger right along that jawline as I'm going along and just having that patient activate so I can see where she is pulling the strongest. We're going to go ahead and repeat this same treatment on the other side, but this is going to help lift and prevent jowling in this area and give her a nice immediate lift in 2 to 10 days as well. So just going ahead and repeating that same process on the other side. Again, I'm staying very superficial and leaving my finger right along the jawline so I can visualize where I am going and where I am injecting. And last injection here, I'm just going back to where she is pulling the strongest for our last bit. And now we're going ahead and doing a lip flip as well. This patient is interested in a little bit of lip filler in the future for some hydration, but for now we are sticking with a lip flip. As you can see, she shows just the smallest bit of gum when she smiles, but I always have the patient activate prior to placing my treatment. This is an area that is a little bit uncomfortable. You can of course numb your patient if they wish, but it is a very quick injection.